If the buttons come off the nitinol wire, identify the end of the wire opposite to the pointed tip. Hold the button with the designated loading side facing the nitinol wire, as shown. Insert the wire through either lateral opening from this side only, then advance the button carefully into position. Do not insert the wire from the opposite side, as this may compromise the intended BioLock functionality of the device. Repeat the same process for the remaining buttons, maintaining the intended order and orientation. Before proceeding, confirm that all buttons are properly seated, aligned, and able to move as intended on the wire. If the nitinol wire is dropped or otherwise contaminated, do not reuse it. Instead, prepare a replacement segment from the portion of nitinol wire previously removed from the driver. Cut a segment longer than 8 inches and use it to reload the buttons in the same manner. Before continuing, confirm proper loading, adequate working length, and maintenance of sterility.